Well, you've probably heard elected officials from the White House to the Jacksonville mayor's office say as the number of cases spikes, we're going to have to learn how to get on with our lives during this pandemic. And you may have heard the phrase herd immunity. Well, that idea is that as the virus spreads more widely, more of us will become immune. But the question is, will that work? Tonight, Katie Jeffries is on your side with a closer look.
More bad news for anyone hoping herd immunity would bring a quick end to coronavirus. New research suggests antibodies from the coronavirus may not last long. Let's connect the dots. We've talked about herd immunity before. It's the idea that a large enough section of the population has antibodies to a disease that it stops or slows the spread. You can get antibodies from a vaccine or successfully fighting the disease. But there is a problem with antibodies. Some last a long time, like the measles or mumps. Others, like the common cold, don't last long at all. A new study out of King's College in London suggests that coronavirus antibodies could disappear within months. The research looked at the antibody responses of 90 patients in England. The majority showed a strong antibody response while they were actively fighting COVID-19. But 3 months later, only 17% had those same levels of antibodies. In fact, levels appeared to fall around 20 to 30 days after the symptoms developed. So what does this mean? First up, this research has yet to be evaluated by other scientists, so more work will still need to be done. But it could affect how vaccines are developed. According to a researcher at the University of Leeds School of Medicine, it means a vaccine will have to generate a stronger response than the natural infection, or it will need to be given at regular intervals like a flu shot. Connecting the dots, I'm Katie Jeffries, First Coast News.